There we go. Sweet. Hi guys. Welcome to the second to last episode of Up in the Air for this season. My name is Mason. Thanks for tuning back. Guys, it's getting scary out again. I originally had somebody else coming on to speak this week, but with the rise of COVID-19 numbers like across the country as well as here in New York, obviously, I thought it was important to kind of give somebody the space to chat who is like a professional on kind of best practices on how we can best take care of ourselves in our community. That person for me is Carlotta Starks. She works in the epidemiology department of New York City Department of Health, working in contract tracing. She is also a registered nurse that has been working actively for the past decade. So knowledgeable. Every time I talk to them, I learn, quite a few things about how to keep myself safe. And I felt that it was like an important time to really let a nurse speak from personal experience about the severity of the moment that we're living in now, because we're passing numbers that haven't been seen since March. We're moving past them in some portions of New York City, specifically like in Staten Island or like Long Island, and it's scary stuff, guys. Not to deter you from watching the episode, Carlotta is super sweet and kind, super personable, and I think will make the medicine of the moment go down a little smoother. With the being said, she also works with Julian Watkins at the People's Clinic, and yeah, just amazing person. So without further ado, give this episode a watch, and I'll check you guys after the episode. All right, take care. Bye. Hi everybody. My name is Mason. Welcome back to Up in the Air. Today, I'm back with another person from the People's Clinic. I felt like this week was definitely kind of necessary to bring back kind of like proper kind of conversations about health with kind of all of the recent spikes in New York City, across the country, with COVID-19. Cases are rising across the country, and some places surpassing a lot of the infection rates that were happening back at the beginning of the year in March, back when I still had a couple more brain cells than I do now. But in a way, our response to it is way stranger, more relaxed as we've gotten more comfortable, which we shouldn't. And I think it is important to, kind of have kind of a discourse on kind of best practices. We had like a shutdown, and I think more assistance from the government back in March to kind of ease into this, despite the fact that easing is probably not the best word. There was way too much turbulence. But I think it is kind of like important, kind of to talk, state kind of the best practices about how to keep you and your community safe. And that is why I am here with Carlotta Starks. They are a host of the People's Clinic with Julian Watkins, who is on a previous episode. And right now they are currently working in contact tracing for the epidemiology department within the New York City Department of Health. And they are a kind of like fountain of knowledge. Just every time that I am with them, I learn so much. And we recently started season 2 of the People's Clinic last Thursday, which will be playing every week on April television. You can also follow them on People's Clinic NYC on Instagram. I am here with the wonderful Carlotta, and I have a bunch of questions about your own personal practice, as well as I think some more pressing questions and about kind of the current state of COVID-19. So hi, thank you on the pleasure to have.
Thank you, Mason, for having me. Thanks for such a thoughtful introduction, and always like thoughtful, insightful things to say. Yeah.
Well, thank you so much. And I think maybe to just kind of tie in, give people kind of like an idea about how you are, it would be great to maybe talk about kind of maybe just giving us like kind of like a brief overview of, I know it's kind of hard to compact kind of like, so what's nursing like during the pandemic, but maybe just kind of to tie together kind of your personal history working as a nurse for the past decade, your overview of just kind of like the pandemic and maybe a little bit of how the People's Clinic has kind of informed what you've been doing in the last couple of months.
Yeah, sure. So as you mentioned, like I'm currently working as like sort of an epidemiologist, doing contact tracing for the schools in New York City, specifically with the private schools. And so what I'm doing is I'm sort of tracking and investigating any COVID outbreaks in the school. And I think the biggest thing with this current role that I'm finding is that like education is like needed on so many levels, and it's a lot of re-education and reteaching in terms of what I'm finding. So even folks who maybe I spoke to last week or a week ago about like what are we worried about? What is the infectious period? What is the incubation period for COVID-19? It's just taking a lot of like education and re-education on like what are the times that we're worried about, and then also like what we're concerned about in terms of like transmission. And so I think for me, it's been having to have like a lot of like patience, but also being aware that like during stressful times, you need as much re-education and as much sort of like, I don't know, you need someone calm and sort of just relaxing and patient with you to like walk you through like what's going on, because I think this is something we've never faced before. And so it's just taking a lot of like learning and relearning, and also, I mean, learning because every day there's something different about COVID that we find out. And so finding it's taking like a lot of patience. But then underneath that patience, there's also just in general with the healthcare system, there's a lot of like frustration and just sort of like general disappointment with the healthcare system in terms of like how we've reacted, but also understandably so because we have limited resources, and because this healthcare system in the US has always felt like a patchwork of sort of systems and hospitals in place to try to protect people. So I think it's just been really sort of like frustrating to be a nurse and know that where there's not enough resources out there, and also know that there are a lot of folks who aren't advocating for the healthcare workers and sort of healthcare as they should. And this is mostly like the government, obviously, from like city to state to federal. I think there's just like a lot of frustration about like how poorly it was handled, and how there hasn't been any sort of like dedication or focus on taking care of like what we would consider in public health like vulnerable populations. And so I think that's like a good little summary. I mean, the biggest thing too, I think, is just that it's been super stressful. So knowing like during this time that a lot of folks don't know what to do, don't know how to like best handle themselves, but also just seeing how there is just a lack of listening to public health professionals has been really frustrating. And as a nurse, like I also do feel really lucky because I don't work in the hospital, so I don't work in inpatient, and I didn't have to see as much or work as much in terms of like I haven't had direct COVID patient care. And so knowing and feeling really heartbroken for like what a lot of my fellow friends have seen in hospitals and in retirement homes and anywhere where they've had to deal with like patients who are struggling with COVID-19 and like the illnesses and all the complexities that it brings with it.
Yeah, I think that is kind of, for me personally, I think like an important kind of headspace to kind of base kind of our foundation of like where I suppose kind of the general public needs to be kind of like viewing COVID. And I think outside of just how politicized and unjustly politicized, like this whole COVID case has become, like it's frustrating to me to kind of have to see, from have all these conversations that we've had this year specifically. I don't think healthcare professionals, outside of maybe early on when people were like clapping outside of their windows for people coming home at 5, 5, 6, has culminated into kind of us actually internalizing kind of a lot of the traumas that I think kind of like nurses working in the front line have to face on a day-to-day basis. And I think like it's like something, it's like a narrative that is very plainly being shut out of discourse at all, you know? And I think you put it like you know, just kind of like talking about your personal experience. You're not only working as like a healthcare like professional, you're working in a lot of ways as like a therapist, a conflict mediator. You're like working with not only the people in kind of you know, at the hospital, but you're working with their families. You're kind of the life, you know, kind of the lifeblood of what is flowing between kind of people working in kind of health and people hopefully getting taken care of. And I think like, I don't know, you've just kind of like enlightened me so much with kind of like how that dynamic is, like from sharing from your personal experience. I think when I'm maybe just kind of to get some of the more, you know, prominent kind of like information out of the way that people need to hear about. As New York is a city is preparing for what feels like a critical, you know, partial shutdown. Schools in New York City last week were all completely shut down.
Public schools, not private schools.
Not private schools, sorry.
As I found out.
Okay, interesting.
which
I think some people are having a hard time gauging, is this current spike as pressing as it was at the beginning of the pandemic?
I would say yes. I think this is sort of like a very critical moment in New York City where like, everyone needs to be extra cautious, needs to sort of like ramp up any sort of precautions that they were taking, any sort of like measures they were taking to be safe, because what I've seen just in like the last 2 weeks alone is just like a huge rise in cases where we're not able to keep up with the work that's coming in. And I say that with like trepidation, like in my voice, because it does feel like the beginning of it going back to where it was, which I think is putting a lot of healthcare professionals and just in general, like a lot of people are, I think, really anxious about like what is to come. And just I can hear it in everyone's voices. I can hear it on calls. I think there's just sort of like a sense of impending doom that like it could get as bad as it was in April if we don't like if we don't take like drastic measures now. And I think that's another reason why there's also like a lot of lively debate about like, why are restaurants still open? Why are some businesses still open? As much as like I want workers to be able to feed their families. I want workers to be able to like go home at night and not have to worry about like where their, you know, like where their next paycheck is going to come from. But also, in addition to that, like I am really worried that like if more measures aren't taken, that like it is going to be bad. And we've just seen rises in deaths, especially including deaths at home. We've seen rises in hospitalizations, emergency room visits. The percent positivity is going through the roof. And so I think this is such a critical time where like, if there is something that you can do to cut down your risk and cut down the risk of others, you should do it. And I say that with like hope that like, I really do hope that like we are able to like not like stop the tide, but like stop what's coming our way, or stop what's really happening around the Midwest, what's happening in Wisconsin, South Dakota, like North Dakota, basically being like the entire Midwest. Because like if individuals are able to like work together and just really take the necessary like harm reduction measures, you could say, like we could stop sort of New York City's healthcare systems from getting inundated and flooded again, and from reaching a point where we're not able to even do contact tracing. And so just a little like, the reason why I say that is because in the end of March and early April, like we were unable to do contact tracing because it was just, there's not enough staff to like do all the contact tracing that needed to be taking place. And we were just completely inundated. There wasn't any point. There was such widespread community transmission at that point. And so we're reaching this point where I feel like we're right on sort of like the tipping edge of like, if things don't change, like we're gonna be there again. And so I really do feel like folks, if they're able to like don't travel anywhere for the holidays, stay at home, don't like avoid public transit if you can. Obviously you have to take it to work, you need to take it to work. Avoid any outdoor dining, indoor dining, like for whatever you can do, like try to minimize your time to less than 10 minutes inside any sort of indoor facility. That includes like the grocery store. So the reason why I say that is just because I also feel like now is the time for you to at least have like 2 weeks worth of groceries in your home at all times, in case you're a contact to a contact, or in case you find out that you were exposed to COVID-19. Like at all times, just try to make sure you have 2 weeks worth of food if you're able to afford it. In your home, but also 2 weeks worth of like deodorant, toothpaste, anything you need to like for your activities of daily living.
Yeah, the one thing that I did learn from you on the most recent episode of the People's Clinic is that limiting indoor kind of like contact to 10 minutes is a pretty new guideline. Or at least I guess kind of the guideline has changed where it is now considered any interaction indoors that's over 10 minutes can be considered I forgot the term that
contact. Yeah, a
contact.
Yeah. So in the schools, like for doing when we're doing contact tracing in the schools or finding out like who has been exposed to COVID-19, we consider 10 minutes in like the same indoor area with someone who's COVID-19, regardless of mask usage. Like basically it doesn't, we're finding this also specifically in the schools that like it doesn't matter if you're wearing a mask or not, the transmission is so high. And this is like for a lot of reasons, because kids are less likely to wear their masks. Also kids are like more likely to be like interacting with each other, running around with each other. But also they're just in such a tight space over a period of time. But the newest guideline that we did increase is basically like 10 minutes of cumulative time over 24 hours. So say for example, I'll just go off my example. So I'm currently on quarantine for another 7 days because my roommate was interacted with someone who was COVID positive. And we asked her, like, and I did like contact tracing for my house. I was like, okay, well, did you spend 10 minutes with this person in a period of time, like with or without masks? And she said, honestly, it was like a few minutes here or there. I couldn't say. And I was like, well, was it 10 minutes over 24 hours? And she said, definitely it was 10 minutes over 24 hours. And so because of that, I just recommended that we all quarantine and get tested for COVID-19 twice. And the reason why I also just say that is because in terms of like incubation period for COVID-19, it can be anywhere from 2 to 14 days. So a lot of people, after they find out that they've been exposed to COVID-19, they go and they get a COVID test right away. But what I would recommend is wait until like day 5, 6, or 7 before you do go get a COVID test, because you're more likely, like the average time where someone's going to show symptoms or show up positive on a COVID test after they've been exposed is after day 5. And so we all went to go get tested around day 4 or 5, but also we're all going to go get tested around like day 13 or 14 as well, just to be sure that like we have not been exposed. Did I answer your question? I feel like I went on a long.
No, that was perfect. Thank you so much. No, I think that's important. I think like kind of like the personal, because the reason why I'm interested in kind of like these personal timelines right now is because I mean, we're not going to have the same sort of kind of culture or like shutdown that happened nationally like we did at the beginning of the pandemic. Like it just doesn't seem like, with how it's being kind of like politically equipped by just kind of various people like in government, and just kind of how 9 months into this, people are just like, absolutely, the fatigue is just like we've passed fatigue months ago. You know what I mean? Mm-hmm. So the way people are managing it now, it has to be kind of like micromanaged by a person-to-person thing. And I think most of it is just kind of the difficult conversation I think that a lot of people are having here is us realizing that it really isn't in a lot of ways a collective effort. It's you having to take the personal initiative to really kind of take it upon yourself. I've had family members that have tested positive and have gone back to work, 7 days later, because they, just
needed to.
they needed to, you know, and you know, it's like frustrating to kind of be within a culture right now where, I'm grew up as like a latchkey kid with a mom that was a small business owner, but worked most, and that really hasn't changed since I'm now an adult living on my own. So not getting any sort of like, her, like my aunt or my cousin not being able to get kind of adequate kind of financial aid during a pandemic to, if they are exposed or if they are positive, not having kind of the financial reassurance that, taking 2 weeks off to self-isolate, um, you know, allows you to do it's putting a lot of people in a catch-22. And I think kind of that sort of fatigue uh on this show specifically, I guess I'm really interested in kind of how people are managing that personally. Uh, you mentioned that you're in isolation now. You've also been working throughout this whole pandemic. How do you think that you've been kind of like managing kind of the multiple stressors of kind of like living in this current kind of reality? Like, are there any sort of like personal kind of like holistic ways that you're trying to kind of counter kind of
the madness
yeah.
in all of our minds, the anxiety, the global anxiety. I think there are times where I'm like, I feel like on top of my self-care and I'm doing a great job. And then like post Biden taking Pennsylvania, I don't think I've like done much self-care. But I have lots of aspirations for self-care. I think the biggest thing I've like come out of this year doing a lot more of is like journaling and writing, because I just find it being really helpful to slow down my overactive mind. Doesn't work all the time, but like when I'm able to dedicate even just like 10 minutes a day, I do find it like really helpful just to like release whatever is stirring in my mind. And it could be like something I heard on a conference call or something I like, like hearing not so great news. Because like every day in the US is not, we don't hear great news. I think the biggest thing for me is also like just staying in touch with my friends. And so even if it's just like a short 1 or 2 minute chat via text, I think that's been like really helpful just to hear how other people are coping and doing during this time. And so, and I try to do a bunch of other things on top of that too, like meditate and do yoga and run. But those happen maybe like a few times a month versus
You're not alone in that.
and then recently, like I think in October, end of September, I just finally was like, I need a therapist, because like this, I need someone who's professional at helping folks deal with stress and anxiety like in my life. And so that has been like super helpful. And also I think it's just been really nice to have something like consistent to like look forward to. So like once a week I speak to someone about like what's going on that week, or difficult conversations I like want to figure out how to have. And so I think it's been like in the last, so October, November, it's been like a month and a half or so. And I think having a therapist before going into the winter was a really good decision.
100%. Yeah. I think so. And I'm really thankful. I guess that's the one net positive and kind of having these conversations a lot, is just kind of the move to kind of circle back internally, which has been, kind of like a difficult, it's a pretty tough conversation to have with yourself, to talk about just outside of just the pandemic, like what holistically kind of is keeping you center right now. And I think kind of that taking so many different shapes and forms for people has been really like interesting for me to hear. Do you feel like your friends like within kind of the healthcare community have also been kind of like on the same wave of just trying to, how do you feel about just kind of being,
I think everyone signed up to, I think everyone's, for the most part that I know of, has signed up for a therapist after peak COVID. Especially like a lot of folks who I think who were in the hospitals and on the front lines. And saw people die every day in horrible ways, like definitely have like stepped up like their self-care. But I definitely think there's also not this area of like not dissonance, but more like I think a lot of folks are just sort of in this anxiety mode where like we never want to get back to where we were before. Like we never want to see people die that way ever again. And I think it does like I'm just being really frank with you because this is what people have said to me, and I don't think it's like things people want to hear. But like I think you need to hear that like people saw things that were traumatizing, and it was not only like once a shift, it was a few times a shift that they were seeing things that like they never, I think you never expect to see in the USA. Like maybe if you were in Doctors Without Borders working in a war-torn country, you would expect to see that much sort of like human life being lost, but not here. I think a lot of folks that I've spoken to too have, I spend a lot of time on Instagram, spend a lot of time like drinking wine. I think there's like I think it's the same with like a lot of folks that I speak to, where like some days are better than others and some weeks are better than others. And so I'm interested in seeing like what long-term our healthcare professionals and also everyone who's faced this going to do to take care of themselves. And like I think there has been more of a shift to do more holistic health and more sort of just like checking in with yourself and self-care, because it's just never been so necessary as it has been now. I mean, I think it's always been necessary, but I think people realize like the toll that the last few months have taken on them, and you have no other choice but to go inwards and just be with yourself a little bit more, even if you don't want to be.
Yeah, I definitely feel that. Thanks for being so frank. Yeah, it's just, it just kind of going back to just kind of like discussing, trying to go a little bit back full circle, is just like the numbers and the kind of quasi like kind of dissociative state that we've been living in is just kind of so hard to, I think, totally wrap any of our collective brains around, because something just gets layered on top of it every time we wake up. And yeah. Hopefully I think kind of like the laxed vibes, I guess I'm kind of feeling from people, just feeling as though that it's just, we're kind of trying to push for a certain level of normalcy, is just only going to get hit with kind of like we're only going to get hit with a wall if we don't understand kind of the severity of what this, we're moving into kind of like Thanksgiving holiday season. I just really want to kind of emphasize and not scare people, but just really take stock of what priority is. And I think a priority is not only keeping ourselves safe, our community safe, but, healthcare workers that have been dealing with a certain kind of unimaginable level of trauma for this past year. Like, can we like, please, this is my soapbox moment. Please really kind of keep these people in mind when you're making decisions that, kind of affect their lives as well. We don't live in a vacuum.
Yeah, we don't live in a vacuum, even though like many people function like they do, as does our government. Anyway, so what, I feel like that's like a very, there's so many different angles that I want to like respond to that question about. And so I'm like trying to figure out like the best one to start with first. And I really think it's just like, if you can, like if you do maybe like have a healthcare worker in your family or a friend, and maybe speak to them on terms of like, what do they think is the best, like what do they think is the best way to like proceed with holidays, proceed with like interactions, proceed with like socializing, indoor dining, like I really think what really helps the moment, and I think what I find being really the most beneficial, is sort of having individual conversations with people, because I think for the most part, when it's like a pundit on TV, or when it's just like general, like, take care of yourself, do this, like, it's not going to make the same difference as having an individual conversation. And that's also just what I've noticed from like doing contact tracing in the schools, is that like that individual conversation, someone being able to have space to like ask questions, to have some back and forth, to discuss, okay, well, like, when is the infectious period? Oh, the infectious period is 2 days before you start to show symptoms. So you're the most virulent, or you're the most likely to transmit COVID before you even have any symptoms. Like, I just bring that up as one example, but like, if you're able to like maybe have a discussion with a healthcare worker, or reach out to me, like, you can tag my Instagram, but like hear from folks and get your quick questions answered, but also know that like healthcare workers are here. We want to be able to answer your questions. That's why I think we got into this healthcare professional, because we want people to be healthy, holistic human beings. And I really think if you do frame it in sort of the way of like, do this for healthcare workers, that also might be a helpful way of just being like, do this for your fellow man, because like, do this for healthcare workers who literally like cannot, it's not sustainable to work in this much of a traumatized setting, to work and see this much loss on a day-to-day basis. And it's also like not sustainable to our healthcare systems. So the more folks that are sick, the worse outcomes that they're going to have, because there's unfortunately, right, like there's limited resources in terms of nursing. And so if there are more patients in the hospital, if there are more patients in the emergency room, more patients in the ICUs, and there's only a few nurses and doctors to be able to take care of them, especially because a lot of them are going to be out too, dealing with their own exposures, people are going to get poor care, and that's going to lead to worse healthcare outcomes. And that's going to lead to also like increased death, which is what we saw in Queens and Bronx hospitals that didn't have as much resources as Manhattan hospitals. And so, yes, take care of yourself, like for your family, for your friends, and the people that you interact with around you that you don't even see, that you don't even know, or maybe like, I don't know, the folks at your bodega, the folks at your grocery store, anything like that. But really like know that like if you get sick and you go to the emergency room, like there's not going to be everyone, there's not going to be the team you need there to take care of you and what you would want to be there, because they're just going to be so strapped taking care of so many people. And so the best way to protect yourself, your family, but also like our fragile healthcare system, is just to like stay home as much as possible, go out only as needed basis. Like, I think if everyone just acts like we are at the height of the pandemic again, like New York City in particular is gonna be spared what is being seen in the Dakotas and in Wisconsin right now, and what we saw in the spring. Anyway, so that trying to be like sad or depressed, but I'm like, yeah. It's really looking. Yeah, I also don't want to see my friends like any more traumatized. I don't want to hear more horror stories coming from the hospital. I don't want to like hear about folks dying who shouldn't have died, because like if there was enough nurses, if there was enough doctors to take care of them, if there was enough medications, ventilators, like they would be alive today.
For sure. I think something that I think like you really shared with me earlier this week as well that really empowered me was like some of like kind of like the infection heat maps, and just kind of getting like an idea of like where infections are taking place in New York. And I think a lot of like resources that are like open and available to the public might just be good to kind of like tell people where to go. Where could people like really be informed about how Corona is affecting their neighborhood nationally, if you have any?
Yeah, of course. So I'll start with the city first. So the New York City Department of Health and Mental Hygiene has an incredible data website. And like I say that because like I think we do have like the gold standard about like how to share data on the latest like trends when it comes to COVID-19. And is it okay if I show my screen? I'll like flip.
Yeah, totally. Please do.
Yeah. Okay. Okay.
Don't ruin any illusion. I promise this is like a zero budget like venture happening.
I know, you'll see how many tabs I have open. Okay, so it is like the New York City COVID-19 data website, and so here you can see like latest trends. You can see totals. You can see milestones. But I would go here to the latest tab, which is like the first page that opens up, and so there's a really good summary that just sort of details how like numbers are increasing, confirmed deaths are decreasing. But this is sort of the most important one where I would say like to just take a peek at when you can. So this is a percent positivity by zip code. And they're doing this on like the most recent 7-day average. And so you can see basically like what zip codes are sort of like the most high risk. So Staten Island is every dark shade of red. So Staten Island is somewhere to be like super cautious about. And then also somewhere to just like, you can see, say for example, you want to go visit a friend or you want to go to the Far Rockaways, maybe just like first take a peek at what's going on in the Rockaways. And so you can kind of see the percent positivity is the percentage of people who are testing for COVID-19, how much they're coming back positive. So this is just a really good heat map to keep track of. And then here too, you can see also some of just sort of like the cases in hospitalization. And so you can see that like clearly there's a significant rise and a worrisome rise. And then in the Bronx as well. And then I also do recommend the Johns Hopkins sort of coronavirus resource center. And so this is really good at sort of like seeing where have states flattened the curve. And for the most part, you can see that like many folks have not flattened the curve, specifically here in like the Midwest, but in other areas. And I also recommend like the New York Times website, but I do like this one with Johns Hopkins, just because it's really good at sort of just like also giving you context in terms of like global cases, US cases, and US deaths, unfortunately.
Well, great. And we'll have links to both of those things in the description below for this. And the last thing is always just a quick plug for yourself. Where can we find the People's Clinic? Where can we find you if you'd like to share?
Yeah, sure. So as Mace mentioned, I'm part of the People's Clinic with Julian Watkins. And so we're having weekly shows where we discuss what's going on in New York City with COVID-19. We give a quick update, but then we also sort of talk about like where we are in this moment in time and give like a bit of like a commentary and critique. And as I'm sure we all have done in this current moment. And you can also find me on Instagram. I'm at Carlotta Manzo, Carlotta, and then Manzo. And you can also find the People's Clinic on Instagram as well. And those will be tagged. So thank you so much, Mason, for sharing this space with me.
Carlotta, thank you so much for coming on. And thanks again. Yeah, it was a pleasure.
Thank you too. Anyone reach out, any questions, anything like that. I think this is all about conversations and all about community, because that's all we have right now. So if anyone needs anything, please shoot me a message. Absolutely. Well, thank you so much. Thank you too. Yeah. Segura, please be safe during this holiday season, and make a conscious effort to keep your community safe and people working on the front lines for you safe as well. I'll post all of the links Carlotta mentioned in the description below. And yeah, I'll be back next week for the final episode. Love you guys. I'll see you guys soon. All right, bye.